Hello everyone, welcome to Pediatrics for Dr. Anand. This is our Pediatrics amazing session. Today's topic of choice is nothing but neonatal reflexes. Hello everyone, how's everyone going? What's happening? I hope my voice is audible to everyone. Please put a message section. Please put a message comment if my voice is audible to everyone. Thank you so much. And this segment, we're gonna talk about the what do you call neonatal reflexes, one of the very amazing segment. And let's cover one by one. Yes, point number one. My name is Dr. Anand, and I'm MD Pediatrics. For the newcomers, I'm gonna be a faculty for pediatrics. And also, the topic of choice we have is neonatology. The subtopic which we're gonna cover is nothing but primitive neonatal reflexes, one of the very favorite topic which examiner ask. Okay, yes, very good. And also at the same time, remember that in Unacademy platform, we have nothing but we have something known as plus subscription and we have iconic subscription. In the plus subscription for the Unacademy, you have amazing access to all the beautiful live and recorded sessions of mine, all the best content of teaching from all the educators all over platform. Hello Sandhu, hello Human. And we also have conducted various live tests, grand tests, and quiz which you can participate, and you can watch the Unacademy on your mobile app, Android app, iOS, and as well as on your laptop. And we have this amazing n number of MCQs. This is the plus subscription. Whereas in the iconic subscription for the newcomers, we have the Unacademy, of course. With that, we have something known as prep ladder subscription. Also, all the videos, all the rapid revisions and treasures, everything we have in the iconic subscription. Okay, and yes, we have this wonderful feature. Hello Shubhangi, hello Balaji, hello Hamid. पूरा दिन लग रहा है कि ये लोग मेरे साथ ही हैं. दिस इज आवर बैक टू बैक सेशंस. मॉर्निंग वी हैड 2 सेशंस ऑन स्पेशल क्लास इन अनअकैडमी और बहुत अच्छा रहा सब कुछ. सो इन द स्पेशल क्लासेस इफ यू ज्वाइन फॉर एन अकेडमी वी हैव द ऑप्शंस ऑफ asking the MCQs. We always create a beautiful poll for that. You can ask your doubts. You never gonna miss my classes because you have all the recorded sessions, and of course the lecture notes which are important for your revision time, and we keep it interactive as much as possible. And yes, this is our very highly effective question bank with 25,000 MCQs and latest exam pattern, image based, video based questions. It will be great. And again, a beautiful, heartily, happy congratulations to all the toppers for the NEET PG September 2021. Our next target is the students who are participating in our classes. Our Deepak, Exportin, everyone, Shubhangi, Balaji, Hamid, Sandhu, Human. I want their names beautifully to be there on this sheet. And also just last day left, only one day left we have for this amazing what you call quiz, which is there on November 28th, which is there on November 28th at 5 p.m. Total free for enrollment is there. 45 MCQs I have made and I'll be asking you in 60 minutes. Try your best to participate. It's totally free. The only thing you get over here is as a scholarship worth rupees 1 crore, and also we get the Amazon vouchers up to 20,000 rupees. Hello Balaji, hello Hamid, Shubhangi. Yes, and we have, you can now speak to the learners. You can speak to me directly in our what do you call the special classes. Okay, and in our Unacademy app. Okay, and also we have created a batch which is already going full for Focus FMG 2022 and Target NEET PG 2022. All the faculties, everyone has been so dedicated, and even the student and the teacher, so that our target is reached. Okay, last but not the least, we have the plus subscription and iconic subscription. You only have to use this code Dr. Anand, which will be easy for you to avail little discount, 10%. It will be easy. Okay, yeah, let's start the whole topic. Today's topic of choice is neonatology. The subtopic of the choice is nothing but primitive neonatal reflexes. A very happy, good, simple, beautiful topic. Yes, Yeah, it will be Sandhu, it will be for all subjects. It is only a time limited period. You can watch, you can avail anytime. It is for all the whole package. Okay, so primitive neonatal reflexes is the topic of choice. And always before starting a topic, we always say a few words. Please don't lose focus. Don't lose focus, Hamid. Don't lose focus, Sandhu, Shubhangi, Human, all export in all our friends who are right now here. I know जो भी होगा अच्छा होगा. Okay, so don't lose focus. Don't lose focus. Buddha, Lord Buddha also is saying to you, don't lose focus. You have got this. I know the journey sounds little tricky and little tough, but if you use little smart work, little brain, and little smartly, if we approach, then anything and everything is possible. Okay, so don't lose focus. Don't lose focus. Okay, just be smart. Don't lose focus. Today's topic of choice is neonatal reflexes. Hello, Sandesh. So, yes, I'm gonna tell you some reflexes. Now, see, it's a very beautiful interactive class. I have made some videos also of my real patients showing you some reflexes. It's a small segment for 30 to 40 minutes. Yes, Shubhangi, positivity really matters in life. I mean, it really matters in life. It can take you out. It can say no that love, respect, and positivity can do wonders. Love, respect, and positivity can do wonders. मतलब कहाँ से कहाँ पहुंचा देते हैं आपको पता भी नहीं चलता. Okay, so the various reflexes which are important for us to understand to clear this exam basically is nothing but number one, we have something known as Palmer grasp. Okay, let me tell you the names first. In this slides, I'm gonna tell you the name of reflex. I'm gonna tell you when does it comes, when does it fully develops, and when does it disappears in this slide right now. Yes. Yes, that's true. So Hamid says how to be motivated all the time. So how to be motivated all the time is by reading lot of motivation quotes, reading lot of motivation stories, watching lot of motivational videos. Whenever you're feeling bored, like whenever in free time, there is always a time when we are free, we're just right in mobile watching Instagram, watching YouTube. That time also watch in Instagram, watch the motivational videos, reels. In the YouTube also watch the motivational leaders who have spoken something. So you have to channelize of the time when you're totally free doing nothing, just surfing on internet. That time also serve something really smart and really useful, and that's what I do. So it's nice. So yes, in this segment, I'm first in this slide. Now listen carefully. I'll be showing you just the names of the reflexes. When does it come? When does it fully come? And when does it disappear? Just in general. And then we will go one by one, videos and pictures of everything. Okay. So Palmer grasp. Palmer grasp. Once I hold the babies, I'll show you a video only. 1 second. I have a very nice video of Palmer grasp. 1 second. Yeah. Now see this video carefully. Yes. Can we see that? Yes or no? This is the most beautiful picture of the day. Can we appreciate a Palmer grass? Yes or no? What do you think, guys? Yes. दिख गया, समझ में आ गया. Photographic memory is everything in life. This is the most beautiful picture of Palmer grass. Thanks to one of my junior Nitin. He had sent me this picture. Very pretty picture. अच्छा लग रहा है मेरे को, तो बड़ा मजा आ रहा है देखने में. समझ में आया नहीं आया? ठीक है. Yes, this is nothing but Palmer grass. So yes, coming to the first exam question, let's come to the slide only. Palmer grass, the onset comes at 28 weeks. The onset comes at 28 weeks. This graph fully develops by 32 weeks and it disappears by 5 to 6 months. Okay, that finishes first NEET PG question. Star mark. These all reflexes are important. 6-7 important reflexes are there. Let's finish them in the next 30 minutes. This class will be exactly for 30 to 40 minutes. 10 मिनट हो गए हैं, आधा घंटा रह गया, अच्छे से पढ़ लो. The first reflex we saw was the Palmer grasp. Once I put my finger over the baby's palm, baby grasp my hand. Okay, so it comes by 28 weeks, fully comes by 32 weeks, and disappears by 5 to 6 months. Please remember, most of the reflexes disappears by 5 to 6 months. Palmer grasp also disappears by 6 months. Moro's also disappears by 6 months. And there is something known as AtnR. AtnR is asymmetric tonic neck reflex. Asymmetric tonic neck reflex, that also disappears by 6 months. So mostly all reflexes in general, some of the important reflexes disappears by 6 months. So now first video question we have already covered, that was palmar grasp. Now second this question I have to tell you myself the video, like you can look at my face, something known as rooting reflex, or rooting and sucking reflex, rooting and sucking reflex. Okay, so Sandesh, Isha, Human, Hamid, Balaji, so everyone is with me, right? Let's finish this class of milestones, of not milestones, I'm saying the reflexes. So rooting and sucking. So once in a circumoral fashion, once I stimulate the angle of the mouth of the baby. Look at my face, okay? If I am a child, like I am already a child, I feel sometimes, if you stimulate my angle of the mouth in a circumoral fashion, this is the angle of the mouth, okay? If you stimulate my angle of the mouth in a circumoral fashion, the baby turn his head towards the source of stimulation and suck the nipple, okay? That is known as, yes, yeah, that is known as what you called in general, what you called rooting and sucking reflex. Okay, if you stimulate the angle of the mouth in a circumoral fashion and the baby turn towards the source of the stimulation and suck the nipple, that is known as rooting and sucking reflex. Okay, remember it comes by 32 weeks, fully comes by 36 weeks, and it is usually, it kind of disappears around 1 month, So okay, Hamid says, Hamid, palmar grasp, dear, some books has given 3 months, but the best answer is usually 5 to 6 months. Usually it is 5 to 6 months. Still, if there is an update, I will let you know, but our Nelson says भैया 5 to 6 months में palmar और plantar grass, मतलब palmar grass disappear होता है. ठीक है, तो palmar grasp over, number 1. Number 2, rooting and sucking reflex over. Okay, then third we have Moro reflex and asymmetric tonic neck reflex. Okay, now we have the videos for that. Now we have the amazing videos for that. Now I'll show you one more video. Okay, what is this? Yes, what is this video? Anyone? What is this reflex are we seeing here? Any random guesses? What is this? So this is nothing but, anyone? Yes, very good. This is nothing but glabellar tap reflex. Okay, nowadays in AIMS they're asking you a lot of image based questions and a lot of video based questions, because Silverman and Anderson score was a recent one of the AIMS random video based question they had asked. So they can ask this also. So this is nothing but glabellar tap. You tap at the glabella and the baby blinks. You tap at the glabella and baby blinks the eye. That's known as glabellar tap reflex. Very good, Isha. Hamid, very good. Suraj, very good. That's very right. Suraj Mathur, sorry. Okay, done. Glabellar tap over. So again, what are we reading? Neonatology. Which topic? Neonatal reflexes. What all did we cover? Sir, you covered something about the palmar grasp. Then you told something about the rooting and sucking reflex. Then also you showed us a video of the glabellar tap. Okay, done. Next question. Yeah, this is already done. Yes, this is one of the most important reflex which you need to understand, something known as, Moro reflex. Okay, this export reflex, exportin says painful, this one glabellar tap. No dear, just like this, okay, just like this, like that, and baby blinks the eye like that. So Moro reflex. Again, for this video I would like to thank my junior Dr. Anurag Vaid from Jammu, one of my favorite juniors who has showed me this video. Now listen, watch this video properly, okay? Watch this video very nicely. See, yeah. So what is this video? Again, watch it. Watch it 10 times. Okay, watch it 10 times. What can you see in this video? Once I suspend the baby head down, once I suspend the baby little down, little baby's head down, baby showing you some three important components of the 3 to 4 important components of the Moro reflex. So what are those components of the Moro reflex? I'll show you one more. This also, can you see this like a semi Moro? But that's what. Can you see that? Little, if I suspend little bit down, baby will be like, that hand, that extension, that whole thing which a baby does. So the most important, first again watch the video. Photographic memory is everything in life. Okay. The components which I saw of the Moro reflex, point number one, yes, the baby will have, one second, yes, the component of the Moro reflex are, number one, there'll be abduction and extension of upper limbs. Abduction. See, what is abduction? What is adduction? Ed, that is known as adduction, and moving away is known as abduction. There will be abduction and extension of the upper limbs. Number one. Number two, did we see the opening of the hands? Again, watch the video. Did we see the opening of the hands? Opening of the hands followed by flexion and adduction. है ना? समझ में आ रहा है? Am I making sense to you everyone? हामिद समझ में आ रहा नहीं आ रहा? हुमान, बालाजी, ईशा, संधु, एक्सपोर्टिन, ईशा again, सूरज. Yes, very good. Okay, done. What are we reading? We are reading Moro reflex. What are the components? Sir, Shubhangi, yes, once I suspend the baby's head down, थोड़ा सा बच्चे को नीचे करता हूँ, तो number one, बच्चा will abduct. He will abduct an extension of upper limbs. Again, watch the video, image, photography memory. Can we see abduction and extension of the upper limbs followed by opening of the hands? Baby hearing opening of the hands, and followed by baby closes his arms, right, followed by flexion and adduction, and third the baby cry. Okay, Mohsin, very good. So these are the components of Moro reflex. One of the very important, one very very commonly asked reflexes is Moro reflex. Okay, that finishes the components of Moro reflex. Yes. Okay, now this is a very, very, very important slide which says the sequence of the appearance of the reflex. Sequence, very important slide. This is a very important slide. Sequence of appearance of the reflexes. Number one, जैसे कि once we suspended the baby's head down, baby did abduction and extension, right? First was abduction. So abduction and extension comes by 32 weeks. Please write in your notes. Abduction and extension comes by 32 weeks of life, like 37 to 41 completed weeks is the term pregnancy, right? If the baby is born little pehle, 35, 32, 30 weaker, so 32 weaker baby will show you abduction and extension, but he will not show you adduction and flexion of the hand. Why? Because वो कब आता है? That comes by 37 weeks. That comes by 37 weeks. So abduction and extension comes by 32 weeks. Adduction and flexion comes by 37 weeks. And one thing which comes very pehle se, very previously, is nothing but opening of the hands. Opening of the hand, that comes by 28 weeks. 28 weeks is nothing but, like, 1 kilo ka bacha, 1 kg baby is just 28 weeks old. Okay, and remember, 1 kg baby, if I make his suspend his head down, neither he will abduct, neither he will adduct, he will only this much. See the video, like this, only this much. So opening of hands, only open the hand and that's it, finished. ना ही वो abduct करेगा, ना ही वो adduct करेगा. These three star mark, it has been an exam question. When does only opening of hands comes? The answer is 28 weeks. समझ में आ रहा नहीं आ रहा? Did you understand this much? Yes or no? Everyone, Mohsin, Human, Exportin, Balaji, Suraj, Hamid, Shubhangi, and 20-30 more other names. Yeah. Okay, great. And so what are we studying? Neonatal reflexes. This is the third, fourth reflex which we are talking. We already covered the components of Moro reflex. Now we got to know the sequence of appearance they appear. And also I got, this is a recent exam question also. Opening of hands comes by 28 weeks. And when does Moro disappears? So what is the best answer? Hamid, this is one of the favorite question of examiners. When does Moro reflex disappear? What will you write? Anyone? When does Moro reflex disappears? Like best answer क्या हो सकता है हमारे इसमें? If the question comes 4 months, 5 months, 6 months, and 7 months, when does Moro reflex disappears? What will you write? Anyone? What will you write in the answer? 4, 5, 6, 7? If you have to choose one single answer, Hamid, what will you choose? Shubhangi has the best answer. Shubhangi says 6 months. 6 is the best answer. Remember, Moro reflex disappears by 6 months. Moro reflex, Mohsin, remember, Moro reflex disappears by 6 months. Moro reflex disappears by sixth months. Okay, that is the best answer. Okay, Mohsin, you don't have to delete your answer. It's okay, bro. I'm not gonna judge you. It's good. Good you're doing mistakes, because mistakes are proof that you are trying. Okay, so Moore disappears by 6 months. Now coming to these important 5 questions. What are the causes of persistence of Moro reflex? Exaggerated Moro reflex, absent Moro reflex, asymmetric Moro reflex, and most common bone to get fracture in a newborn. These are the most important questions in general we need to understand. 5 questions. This slide has 5 NEET PG questions, 5 exam questions. Let's do the easy ones. Most common bone to get fracture in a newborn. Anyone? Even my grandmother also can tell this answer. Which is the most common bone to get fracture in a newborn? Ishita? Very good. The most common bone to get fracture in a newborn is nothing but clavicle. The most common bone to get fracture in a newborn is clavicle. Isha is right. Hamid is right. Exportin, it's clavicle. Sandhu, clavicle. Clavicle. Balaji is also right. Perfect. Very good. Very good. Okay. Let's do the other easy questions. Asymmetric Moro reflex. What are the various causes? Like again in this video, if you see, once I suspend the baby's head down, it's like symmetrical abduction, extend, like abduction, opening of hands, adduction, and baby cry. Symmetrically it is happening, right? What are the causes of asymmetrical? मतलब बच्चे को अगर if I make the baby's suspend head down, only one hand is moving like that, but the other hand is totally down. Anyone? Yes. Something known as Erb's palsy. Yes, that's right. Very good. Other causes are, have you heard of Klumpke's paralysis? Anatomy. Who's a topper in anatomy? Raise your hand. Klumpke's paralysis. Have you heard of fracture clavicle? Even fracture clavicle baby also will not show you a proper muru. Could be a brachial plexus injury. Yes or no? Brachial plexus injury. And could be a case of congenital hemiplegia. Congenital hemiplegia. Yes or no? So yes, these are the causes of, or even shoulder dislocation. Same thing, fracture clavicle, shoulder dystocia, all those things. Shoulder dislocation. Yes, very good, Hamid. Very good, Isha Srivastav. Yes, Sandhu, Isha, very good. So various causes of asymmetric Muru are Erb's palsy, Klumpke's paralysis, fracture clavicle, brachial plexus injury, congenital hemiplegia, and shoulder dislocation. Okay, so in these 3 NEET PG questions, we covered 2 questions. Most common bone to get fracture in a newborn. What are the causes of asymmetric Muru reflex? Okay, asymmetric Moro reflex. Yes, so fracture clavicle over, Erb's paralysis over, and Erb's palsy C5, C6 is the main root value. Sometimes this says C7, but mostly it is C5, C6, and it is also known as Vater's tip. Vater's tip. Okay, Erb's palsy is known as Vater's tip. Star mark, double star mark. It has been a PG question as well as super speciality question. Vater's tip, and the hand becomes like that, known as Vater's tip, right? And shoulder joint dislocation and congenital hemiplegia. These are the various thing of asymmetric Moro reflex. Okay, let's move further. Yes. Okay, so this question came in AIMS. Let's do the MCQs also back to back. AIMS May 2014. Asymmetric Moro reflex is an indicative of what? HIE, brain damage, Erb's palsy, and conductors. Please put a message in the comment section. What do you think? And HIE is nothing but hypoxic ischemic encephalopathy. Hypoxic ischemic encephalopathy. ठीक है? So what do you think? Anyone random guesses? Yes, Erb's palsy. Erb's palsy is the best answer. Asymmetric Moro reflex is indicative of Erb's palsy. Can we see this picture? Yes or no? Hamid, photographic memory. Can we see this baby's one hand is like internally rotated? Yes or no? Kind of a Vater's tip? Yes or no? This is nothing but Erb's palsy, right? Waiter's tip, one hand. Can you see this hand is rotated like that? Okay, Priyanka, Sani, Sandesh, है ना? Very good. So that's what you should know, kind of Erb's palsy. Erb's palsy, okay? Now remember one thing. If the question comes, the baby no, like if the question comes about the asymmetric Moro reflex, of course our best answer will be Erb's palsy. But with the Erb's palsy, if the question has told the patient is also having some facial features, the MCQ says the baby is having asymmetric Muru, and also there is like kind of meiosis or some facial features are also there. Then what will you think of? Then you will think of Klumpke's paralysis. Klumpke's paralysis. That is again a MCQ. That's why I'm telling you. See, if the question comes like this, okay, asymmetric Moro reflex, most commonest cause or indicative after birth, indicative of what? The answer is Erb's palsy. But a patient of Erb's palsy, like asymmetric Moro reflex, also having some facial features like meiosis or any kind of facial feature, you will always think of Klumpke's paralysis. Klumpke's paralysis, because in Klumpke's paralysis, the lower part of brachial plexus C8 and T1 is also involved. And remember, Klumpke's paralysis is nothing but claw hand. है ना? We come Klumpke's paralysis is nothing but claw hand, whereas Erb's paralysis is nothing but waiter's tip. These again star mark. These two are exam questions. Waiter tip जो मांगता है, waiter's tip is nothing but Erb's palsy, whereas claw hand, the hand become like a claw, is nothing but Klumpke's paralysis, because they involve the lower segment of the brachial plexus and facial features are there. What all facial features are there? The mnemonic for this one is nothing but Pamela Anderson. The mnemonic for this is Pamela. 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 P for anyone. This is a very old mnemonic. Kuldeep, Exportin, Isha, Sandhu, Balaji, Hamid. Have you heard the mnemonic of the Horner syndrome? This is nothing but the patient can land up into Horner syndrome. Horner syndrome. The mnemonic for that is Pamela Anderson. P for ptosis. A for anhydrosis. Yes, very good. M for meiosis. Very good. Yes, Isha. E for enophthalmos. L for loss of ciliospinal reflex. Yes, very good. And A for anhydrosis. Anhydrosis. 10 more minutes and this class is over. Okay, then later at 4 o'clock I have a class. Yeah, 4 to 5 p.m. I have a class in the what do you call it, in our special class, and we're going to continue this and do the other topics. I'll repeat again. Let me repeat everything. What are we reading? Neonatology. Which subtopic? Neonatal reflexes. Which reflex are we mentioning over here? Sir, one of the reflexes, one of the things you told about asymmetric Moro reflex. Asymmetric Moro reflex, right? Yes, right. In asymmetric Moro, you told something about Erb's palsy, Erb's palsy and Klumpke's paralysis. Erb's palsy, what happens? Policeman's tip happens. Like a asymmetric Moro, the hand is internally rotated. So Erb's palsy. Also, if there are facial features, are involved, you will think of Klumpke's paralysis, because in Klumpke's paralysis, the lower segment of the brachial plexus is also involved. So the patient can show you the features of Horner syndrome. Like this Klumpke's paralysis is associated with Horner syndrome because of the same root value and everything. So Klumpke's paralysis patient can show you Horner syndrome features also, and those features basically are nothing but Pamela. P for ptosis. Take it, ptosis, drooping of the eyelid is nothing but ptosis, and drooping of the eyelid. Anhydrosis. What is anhydrosis? Anyone? Sandhu, Priyanka, Hamid, Exportin, Srivastav? Yes. Decrease, yeah, right. Decrease sweat. Decrease sweat is nothing but anhydrosis. Meiosis. What is meiosis? Anyone? Sandhu, what is meiosis? What is mydriasis? Yes, yes, very right. So constricted pupil is meiosis, whereas dilated pupil is mydriasis. Constricted pupil, right? Enophthalmos. What is enophthalmos? Yes, Anju. Now a newcomer we have Anju Mohan. Okay, Sandhu. What is enophthalmos? Yeah, Very good. Sunken eyeballs. Sunken eyeballs is known as enophthalmos. Loss of ciliospinal reflex and anhidrosis. Sorry, and yeah, anhidrosis is over here, so we can write anisocoria. Anisocoria. What is anisocoria? Anyone? Yes. Anisocoria. Yeah, you can say that decrease in the size, unequal size of pupil. Unequal size of pupil is known as anisocoria. Anisocoria. Enophthalmos is sunken eyeballs. Yes, that's right. That finishes the Horner syndrome. That finishes the Klumpke's paralysis, where lower segment of the brachial plexus will be involved and features of Horner syndrome will be seen. Okay. Did you understand everyone this much? Tell me yes or no. Let's take a break for 5 seconds. Did you understand this? समझ में आया कि नहीं आया ये बताओ. Okay, very good. So good, Sandhu, Shubhangi, Balaji, Hamid, and Human. Very good. So 5 questions we had. First question was over. Most common bone to get fractured in a newborn is clavicle. Asymmetric Moro reflexes causes we wrote. Now very important, something known as persistence of Moro reflex, exaggerated Moro reflex, and absent Moro reflex. Now this is something a very nice question they have told. एक होता है persistence of Moro reflex. Normally, the Moro disappears by how many months? 6 months. If it is persisting for 8 months, 10 months, 9 months, 12 months, then the first thing you will see is the cerebral damage. Cerebral damage. One of the important causes, star mark, it has already been an exam question. One of the important, what you call, yes Sandesh, you are right, Isha is also right. So cerebral damage, whenever there is a cerebral damage, there will be persistent of Moro reflex. Persistent of Moro reflex. Now there is something known as exaggerated Moro reflex and something known as absent Moro reflex. Means once I suspend the baby's head down, normally bacha thoda sa, little bit he does abduction, opening of hands, adduction, and baby cry, but it's exaggerating like that, exaggerating. So exaggerated Moro reflex, please have remember, number one, it is seen in hypoglycemia and also in stage 1 HIE, in stage 1 HIE and hypoglycemia. Please remember now this new word, something known as HIE. What is HIE? Hypoxic ischemic encephalopathy. Hypoxic ischemic encephalopathy. What is this HIE? Hypoxic ischemic encephalopathy. What does it mean? इसका मतलब क्या होता है, मतलब क्या है, क्या चीज ये? How should I remember this for exam? In general, I told you it's better to give good baby than giving a bad baby to a family, right? So if the baby has not cried, if there is no cry, the baby has not cried immediately after birth, what happened? It basically leads to the brain damage. It leads to brain damage, or you can say it leads to irreversible brain damage. See, listen to me carefully. Okay, very good. Yeah, that's very right. Sandhu, normally a baby should cry. Normally, once baby cries, see baby crying. So once he baby cries, his lungs, basically his lungs inflate and deflate while crying. So once this thing happens, brain gets the oxygenation. Once the baby not cried, like fully down, then baby will not take breathe and the oxygen will not reach to the lungs, to the tissues, basically leads to the oxygen will not reach to the brain. That leads to hypoxia. And hypoxia ke karan, very true, because of the hypoxia there will be necrosis, there will be ischemia, and that leads to brain damage. So hypoxic ischemic encephalopathy, HIE is a 5 marks MBBS question. If the baby has, in simple shabdon mein, the baby not cried immediately after birth, the baby can land up into HIE. And HIE has 3 stages: stage 1, stage 2, and stage 3. And the name of the staging is SARNET and SARNET. Please remember the name of this staging, just the name. For example, to assess the severity of distress in a preterm child, what staging do we use? Sandhu, Hamid? To assess the severity of distress in a preterm child, what is the name of the staging we use? Anyone? Yes, very good. So we use something known as Silverman-Anderson score. Yes or no? Have you heard the name? Silverman-Anderson score. What is the scoring system? To know the assessment of distress in a preterm baby. Yes or no? Yes, very good. So the name is Silverman-Anderson score. That is the name of the scoring system. Same goes over here for the staging of the HIE. For staging of the HIE, we have something known as Sarnet and Sarnet staging. Sarnet and Sarnet staging. It is the name of the staging, which has stage 1, stage 2, and stage 3. Stage 1 will always have an exaggerated Moro, है ना? And stage 3 will have a absent Moro. Moro मिलेगा ही नहीं. Baby will be very down. So one of the causes of exaggerated Moro is stage 1 HIE and hypoglycemia. And other cause of absent Moro. Absent Moro you see number one in what you call stage 3 HIE and even Down syndrome also. Down syndrome also you can say you see a very poor Moro reflex. Did everyone understand this much? Yes or no? Very good. So, Kostub modified Bell staging. Kostub necrotizing enterocolitis. You see modified, not just Bell's, modified Bell staging. You see in word and necrotizing enterocolitis. Done. Okay, yeah. So absent Moro reflex you see in Down syndrome, you see in stage 3 HI and also connectors. Once the jaundice has crossed the blood-brain barrier, it can cause connectors in a child. So that is connectors. Then that finishes this part. Let's revise again. Today's topic of choice was nothing but miles, yeah, what do you call reflexes. The reflexes which are important. Palmar grasp one reflex which we covered. I showed you the video. This was one glabular tab reflex which we covered. Then we covered something known as what we call palmar grasp reflex is very important which we covered. Then we covered something known as Moro reflex. The components of Moro reflex. Moro disappears by 6 months. That these all parts we covered. Now go to the next one. Okay, done. Okay. Now I have this very nice video. Let me see if anyone can answer. This patient had come to my OPD, was referred from AIMS. Now watch this video and tell me the answer. Watch this video and tell me the answer. What do you think? Watch this video and tell the answer. क्या बच्चा क्या कर रहा है? What do you think the baby is doing? Anyone? Again, if I show you this video. So this, yeah, very good. This nothing but, yes, it's a case of Erb's palsy. It's a case of Erb's palsy, or you can say waiter's tip. Waiter's tip. कैसे पता? That's what. Can you see? See, one hand of the baby is nice, normal, he is sucking it, but the other hand is down. I was trying to put his hand back again up, but again his hand was down. That is known as waiter's tip or Erb's palsy. Very good. Yes. Next important, last reflex comes over here. Important is nothing but AtnR. What is AtnR? AtnR is nothing but asymmetric tonic neck reflex. Asymmetric tonic neck reflex is the name of this reflex, AtnR. It is also known as bow and arrow reflex. It is also known as bow and arrow reflex. Okay, very good. Yes, very good. Combat healer is right. Hamid, Balaji, Isha, Exportin. So many people have told the answer. Everyone wants to pass this exam, I guess. Very good. Sandhu, Anju, Prithvi, new names have come. Means these all guys want to pass this exam, I guess. Very good. This last reflex for this one in the next segment we'll do the part 2 for reflexes. This is nothing but AtnR. What is AtnR? Asymmetric tonic neck reflex. क्या होता है सर ये? कैसे करते हैं? क्या होता है ये सर? It is also known as bow and arrow reflex. Now look at me. Look at me. If I turn bow and arrow, this bow and arrow, right? This one. If I turn the baby head to one side, if I turn the baby head to one side, one limb will flex and one limb will extend. That is known as bow and arrow. Bow and arrow reflex. Okay. If I turn the baby's head to one side, one part will extend and one part will flex. That is known as bow and arrow reflex. Bow and arrow reflex, known as AtnR. And remember, there's something known as symmetric tonic neck reflex. Symmetric tonic neck reflex, and something known as AtnR, asymmetric tonic neck reflex. So remember, AtnR, at, this is present at birth. Symmetric tonic neck reflex is one neonatal reflex which does not present at birth. It presents later in life. Exportin says how to treat. No dear, this is nothing to treat. For 6 months of life, if I turn the baby head to one side, one part will extend and one part will flex. This is normal. This is normal for a baby. But at 6 months of life, this will disappear. This will disappear. Please remember, at 6 months of life, when I turn the baby head to one side, this flexion and extension should happen. One part should flex and one part to extend. But at 6 months of life, the baby will not do this bow and arrow. He will roll over. He will roll over. That comes to another very important NEET PG question: when can a child roll over? बच्चे उल्टे से सीधा और सीधे से उल्टा कैसे हो जाता है? This one. Okay. Yeah. So that's what. Okay. Okay, Anju. Yeah. ठीक है. Okay, I'll tell you. So, did you understand this much? So, I'll repeat again. AtnR. AtnR is asymmetric tonic neck reflex. It is also known as bow and arrow reflex. It disappears by 6 months. It appears at birth. It appears at birth. AtnR. No. A for AtnR, A for at birth. And symmetric tonic neck reflex comes later in life. And once the AtnR disappears, a baby can roll over. A baby can roll over. Okay. And one extra point you need to understand, that voluntarily grasp appears when palmar grasp disappears. I told you, right? The first thing, palmar grasp, baby's palm is like this. If I put my finger like that, baby will grasp it. So this is something disappears, and then voluntarily grasp comes, that I want to hold intentionally, voluntary I want to hold or not. So voluntary grasp appears once palmar grasp disappears. And earliest neonatal reflex which disappears is the, in general, is the rooting reflex. The earliest neonatal reflex, rooting, no, that once in circumoral fashion I touch the angle of the mouth. So earliest neonatal reflex which disappears is rooting reflex. And remember one thing, yes, this is a good one. Moro reflex once disappears, never reappears. That baby which is 45-degree, head I suspend down, and baby do abduction, extension of hands, adduction, and baby cry. So once the Moro disappears, it disappears by 6 months. It never reappears. It never reappears. Okay, it never reappears. That you should know. That's it. In the next segment, we're going to talk about what you call parachute reflex. This is the next segment where we're going to talk about parachute reflex. That's it for right now. Being, thank you so much for the participation. Thank you. And again, for, as I always say, like don't lose focus. You have to do, there is a saying, right, which I was telling you: failure is not life. It is a part of life. Sometimes we feel कि भाई जिंदगी खत्म हो गई, सब हताश हो गए, oh my god, how will I do it? So failure is not life, it is a part of life. So this phase also will go one day. Okay. Thank you so much. Thank you so much for the participation, Sandesh, Dhananjay. Need 22 delay, पता नहीं यार, मेरे को तो idea है नहीं. We have not got the update yet, dear. Once we get it, surely I'll tell you. Human, Combat, Sandhu, very good. My next session, the next session is again today. What time? It is at 4 p.m. 4 p.m. to 5 p.m. we have this amazing neonatology part 14. We have where we're gonna talk about pediatric dermatology, nice ones. And also I will cover a little bit of reflex also if possible, and pediatric dermatology also will cover. Thank you so much. At 4 o'clock, see you in this special class. है ना बालाजी? Okay, Dhananjay. Yes. ठीक है. शुभांगी, thank you everyone. Thank you. Take care. चलो खाना वाना खाओ अच्छे से. मिलते हैं, 4 बजे मिलते हैं, आ जाना टाइम पे। हामिद, एवरीवन, संधू, प्रियंका, प्यार से आ जाना, ठीक है, वरना डांटूंगा मैं।